Hello, everyone. I wanted to take a bit, I don't know how long, I'll try and answer all the questions that come to me about what's going on. So, one of the questions I get fairly frequently is, did you finish chemo? And the answer is kind of yes. So, I started chemo on August 15th. I did 6 cycles. My last cycle was December 4th. Excuse me. I had chemo every 3 weeks. If you do the math, you'll see that there was 1 week where I went 4 weeks instead of 3. But otherwise, I did stay on schedule, and I completed all 6 scheduled cycles. And the chemo that I did was TCHP, which is the chemo is Taxotere or Taxol and Carboplatin, and the HP are the antibodies, Herceptin and Perjeta. So that's the protocol cocktail, whatever you want to call it, that I had 6 cycles. And then if you're following along with my regular videos, you'll know that this past week I did a cycle 7, but that was just the Herceptin and Perjeta, just the antibody. So I can say that I did block this out a little bit. If you look at the description, you'll see that I kind of wrote down the next steps, and my next steps in August were I have this set of goals. And so my current set of goals were to get through the 6 cycles, which I've done, check. Excuse me. And then I can't recall at the moment, and I'm sure that will be updated, if it's a full year on the antibodies or 18 months, like an additional year. So I think it's a full year. So I think I have to go till next August with the antibodies. But all of that is subject to change. So let me talk about what's next. Let's start off before we go to what's next. Let's talk a little bit about what's been. So if you haven't been following along with my daily kind of quick updates, this chemo was difficult from the perspective of it was a 3-week cycle, and I spent at least 2 weeks, sometimes a little more than 2 weeks, just kind of knocked off kilter, totally feeling horrible, resting, and my body just couldn't do things. But for the first few cycles, I would say cycles 1, 2, and 3, by the time I got to week 3, I felt not fabulous, but not horrible. Had a lot of my energy back, could move around, didn't feel as sick. Still, you have that bad taste in your mouth and those other things, but generally speaking, okay. Coming into cycle 4, starting to that bounce back wasn't happening as much. In cycle 5 and 6, I just felt horrible all the way through the cycle and into the next cycle. Not as bad as I felt right after treatment, but I didn't get that bounce back where I felt like I was back to my energy, that I could move around. And for cycle 6, which I'm in right now, well, I guess technically I'm in cycle 7, I just felt totally, totally exhausted. And again, if you're following along with my daily stuff, I apologize because you're going to hear some stuff you already know, which is in my cycle 5, my labs started to decline. In cycle 6, they really decline. And right now, they're not I don't want to say critically low, but they're not good, right? Several electrolytes, calcium and potassium, and possibly magnesium, I don't think we were checking that one, are on the lower side, and we're supplementing. And my hemoglobin went from normal into just under normal to not good, almost need a transfusion. Not there yet. Generally, the rule of thumb is you have to, if you're below a 7, then they would transfuse. Then I was at 7.9. However, the labs that we had done 3 weeks prior were 9.7. So in the 3 weeks, I went from 9.7 to 7.9. I haven't had any chemo, so presumably my body should be recovering and fixing itself, and all that damage from the poison should be getting out. But so far, not feeling great. And that was from the labs that we just did on Tuesday. And I'll be going back again this coming Tuesday to see if we've recovered more on the hemoglobin side, do some iron studies, and also all the supplements, see if the supplements are helping and bringing up those electrolytes. I'm still feeling very exhausted. So not particularly happy about that, but right now the belief is that's just side effects of the poison. and the cumulative side effects. So I don't know that people talk about it so much, but given that this is my third time on chemo, every time even though there's 3 weeks between each of the cycles, every time you get the poison, that poison gets kind of added on to the last one. So presumably most of the poison is out before the next one gets added in, but it's kind of a cumulative impact on your body. And that's why we're seeing, in my body at least, in cycle 5 and cycle 6, just the kind of bleh. And if I had had these kind of results after cycle 4 or 5, then I might not have got to cycle 6. But I guess great, my body was strong enough to get to cycle 6. But now we're kind of like lagging along. So that's kind of what's happening. So right now my focus is just trying to eat as much as I can and rest and take the supplements and get as better as I can. Because this isn't really living from my perspective. It's a lot of resting. Like I can do something and then I rest, do something and rest. And I'm going back to work in a couple days. So hopefully that'll kind of prove out. So then the next thing what's next, I guess is the question. And this has always been the plan. I have surgery scheduled on January 23rd. So today is December 30th, I think. December 31st. So in just over 2-3 weeks, I'll be having surgery. What is the surgery? The surgery will be to remove the implants. And I think we've talked about this in another video, but I had a bilateral mastectomy about 9 years ago and with reconstruction, and I'll be removing the implants and removing any tissue that previously touched breast tissue. Because, as I already mentioned in some other videos, there was only a 1% chance that I could get breast cancer because I had previously removed all the breast tissue except for little teeny microscopic bits. Unfortunately, those bits had some cancer in them, I guess, and here we are. So it's my choice with my doctors and my family to remove everything, and hopefully we're not going to revisit this. Again, very, very fortunate that 9 years later, I'm not looking at a metastatic or a stage 4 breast cancer, that it was stage 2, that we caught it so early. But there was no reason for any of us to believe that I would get breast cancer again. The chance was less than 1%. We weren't really looking. It just happened to pop up on another scan. We got really lucky there. Very fortunate. But, I'm kind of done. I don't want to be worrying about this anymore, and I'd like to just remove all those chances. So that's the next steps. So it's supposed to be an outpatient procedure. We'll see. I'm trying to think, what else can I tell you about that procedure? I expect that the recovery will be anywhere from 2 to 6 weeks. They're telling me, 6 weeks will definitely be I won't be able to lift things or do anything with my upper body because it's a fairly significant surgery. But will I start to feel myself again is the question. In a few weeks, maybe. We'll see. Not sure how invasive it will be because we're taking out the implants, but the implants are not really me. It's not like the mastectomy itself where we removed my innards. That was a very difficult surgery to recover from my opinion. So that's the next steps, is the surgery. And then the pathology from the surgery. So they're going to take out all that tissue and then there will be full pathology on everything that they remove. If the pathology is clean, like the chemo, these 6 cycles killed everything, thumbs up. I think that the plan then is to continue that antibodies, Herceptin and Perjeta for, I'm thinking it's a year, but I gotta, that'll be a discussion with the doctor. Just to be on the safe side and make sure nothing has an opportunity to grow. And if the pathology is not clean, then it's a new discussion with the doctors about what kind of treatment do we need? Is it a chemotherapy? Is it a chemotherapy and a radiation? Is it just a radiation because you just did that chemotherapy? Is it a different generation of the antibodies? Like I'm taking 1st and 2nd generation antibodies. There are now 3rd and maybe 4th generation. So there are other options if those aren't doing the job. So But that's a discussion for after the surgery and the pathology. And I've kind of segmented things in that way. So in my head, I needed to get through the 6 cycles, check. Then the surgery, almost. I got a few more weeks. And then the pathology. And then there's decisions to be made based on that pathology. So fingers crossed and prayers. I'll take all the happy, good thoughts from you about the results of that pathology being clean. And we did all the chemo did the job. That will be fabulous. But if it didn't, then there'll be more work to do. I'm hoping for no more work. I'm pretty darn tired from the work we've just done. I know it seems like it was just a few months. When you look at it on a calendar, August to December doesn't seem like much, but it's been a rough several months, and I would not like to do more, but I will if I need to. So that's our next steps right now. So we've just checked, we did the chemo. We will continue to do the antibodies. I think I've discussed in another video about how the antibodies work, but I could give you a little quick summary. My cancer is HER2 positive. The antibodies, HER2 is a receptor. And basically about 20 years ago, the HER2 breast cancers were the most deadly because the HER2 receptors allowed the cancer to replicate faster than the chemo could kill it. And by taking the antibodies with the chemo together, the receptors, the antibodies interrupted those receptors and prevented the HER2 from replicating quickly. It's basically interrupting that process, the metabolic process, and not allowing the HER2 gene to replicate the cancer. So the reason that you continue to take it even after you're done with the chemo is if there are still some HER2 receptors in there, they want to make sure that they're not doing any replicating for quite a while. And that's why and presumably because it's just targeting those those receptors, there are not the significant side effects like no hair and the bad taste in your mouth and the nausea and the vomiting and all the other symptoms that you get from the kind of the blasting chemo you don't get from the antibodies. So it's also a way to continue treatment and make sure that your cancer isn't growing without having all those yucky side effects. Now there are side effects, as you all know. I get something that I refer to lovingly as Perjeta's revenge, which is like a GI diarrhea type thing, and that is from the antibody. And there are options that, would not have that. And if the diarrhea or the symptoms of diarrhea get too much, then they might change the antibody just for that reason. But we're not there right at the moment, so we'll see. And I'm trying to think, what else can I tell you? So that's basically the plan. We've done the first part of the plan. We're continuing with the second part. The third part is the surgery. The fourth part is the pathology. And once we get that pathology, which I assume will be the end of next month, so maybe in a month and a half, we'll have the new plan. And I hope that the new plan is just finish out your antibodies and you're done with this story. That's my hope. But we'll do what we got to do. So if you have any other questions, if I didn't answer anything, if I didn't make it clear what the next plan is, or if I left anything out, please feel free to comment below and I'm happy to elaborate either in another video or in the comments. And thanks again for coming along and all your support and love. I really appreciate it. It really helps me get through the bad days and the good days. Tomorrow's going to be a better day. Have a good one.